Welcome to your town once again. Hopefully everyone is sheltering in place and looking forward to better days. The coronavirus has changed our world upside down, sideways, especially for our elderly community. This is the topic for today. I want to thank my two guests here, Dr. Kaplan and paramedic Ryan Snell. So we'll start with Dr. Kaplan. Just a few words about yourself, if you don't mind.
Not
Thank
at
you.
all.
Welcome.
Born and raised in New Bedford. My parents were here for most of their adult life. I came back to New Bedford in the early 80s to work, and basically worked for the next 38 years at Hawthorne Medical, mostly cardiology, but also internal medicine. Have a deep-seated love and affection for the community, and when my wife and I have been settled here for several years. I retired, as you know, a couple of years ago, but happy to help out in any way that I can. So
You never retire as your doctor.
even if you want to, it turns out you never retire. That's true. But thank you for having me.
Thank you. Thank you for coming. And paramedic Ryan Snell, welcome.
Thank you. Thank you for having me. I, too, am a native of Dartmouth. I've been here my entire life. I've been involved in public safety for the last 13 to 14 years. I've been on the ambulance for the last 11. And recently I've been moved up into operations, and now currently I'm running mostly field operations for the 911 response to the town of Dartmouth.
And you're busy, huh?
Steady.
Yeah, I'm sure. I'm sure. And thank you very much for coming in.
Thank you for having me.
So every day the news constantly reports about COVID-19 pandemic locally, throughout Mass, here in the United States and globally. Frequent reports of COVID-19 activity, frequent reports of hospitalization and mortality. What we would like to talk about here and with our guest is something other than the health issues that we hear every day. And that's why we are here to talk about this. Here in Mass, many businesses have been impacted by forced closures through various orders issued by Governor Baker. These orders are issued to manage the spread of COVID-19 by closing certain businesses that is otherwise open would increase the transmission of COVID-19. And I think that, all in all, I think the governor's done a heck of a job, and our surrounding governors have done a terrific job. It's quite a challenge, and locally we have the same challenges. Not as large, but it all matters. So that being said, some of the businesses include doctors' offices. However, this is not a reason to ignore your personal health or your friends, family, and neighbors' health. Let's talk about their concerns with the patients, and that they really should not be afraid to visit urgent care, or for that matter, to see their doctor. So if you'd like to kick off on that, Doctor, I'd like to hear something more in detail that you can give to the seniors.
Sure. I think everything you've said is clearly correct. The governor, I think, has done an excellent job. He's been articulate, he's been consistent. I would say, and then we'll move on, that this is a national problem, and it really requires national solutions. Those have not been forthcoming, personal opinion, but I think people have worked hard locally to fill the gap. Certainly the governor has done his job. The mayor, I think, has been also very consistent. New Bedford mayor, very consistent, very articulate with things. The hospital has responded. They've upped their access and they've upped their capabilities to what they need to do. So I think all the local players have done their part. When it comes to the physician's offices, I have to speak not from experience, because obviously I'm retired, but I have talked to several of my colleagues over the last couple of weeks, and it's really rough in the office right now. People have been told to stay away, and I think that was the appropriate first response, that people would mitigate exposure by not going to the office. The consensus at the office was, why am I bringing in people who, by definition, most of them are sick and elderly, over 60, if you will? Why am I bringing somebody in for a routine checkup in the middle of a pandemic? So most offices, I don't know of any offices locally, but most offices in every sector basically stop seeing people except emergencies. And I think nobody really anticipated how complete that would be. So what's happened afterwards now is that we have a group of people who basically have been afraid to go to the hospital or afraid to go to the doctor's office, and we're missing diagnoses.
And we're putting them in jeopardy, unfortunately, because they're so, they're conflicted because of, you read one day it's this, and of course I know everybody understands that this pandemic is, and this COVID-19 is something we've never experienced. So every day is a new day. The ball keeps moving from this place to that place, and it's like the field goal goes from front to back, and it becomes, and the elderly are concerned enough about their health, and now that this is what precipitated me to have this program today, to quell their concerns.
Right. So we should spend a minute just on that particular piece.
Yep.
And there is no real data that suggests, well, there's a lot of data to suggest the opposite, which is that if you're sick, you need to be seen. And what's happening now, from what I'm reading and from what I'm hearing, is that people are sitting at home with significant symptoms because they're afraid of being exposed to the virus. Perfectly reasonable at the beginning, until we understood how the virus was transmitted and that we understood how to prevent that transmission. So every place now, physicians' offices, even urgent care centers, or the ER at the hospital, have designated special areas to handle suspected COVID versus what I would call normal flow. So people should not be reluctant to seek care if they have symptoms that are significant. People are ignoring chest pain now. People are ignoring early symptoms of stroke. And basically, we're finding that people are having severe complications and consequences. So the message needs to go out. It's safe to go see your doctor. It's safe to go to the emergency room. It's safe to call 911 if you need help. If you don't, you're really putting your life at risk in significant situations. I mentioned this statistic, and I'll throw it out just so people understand that in a normal day in New York City, 25 people die at home. Since the pandemic started, it's now been about 125 or 150 people a day. Now, obviously, some of those are COVID related, but there's a bunch in there, I'm sure, that are not, that people waited too long with chest pain, waited too long with a stroke, and succumbed at home. But maybe some further, I mean, I don't know how busy you folks are and what you've been up to and what you're doing and what you're seeing, so I'll let you speak to that.
Yeah, we definitely have that sense and the same feeling that maybe the elderly or even the general population is afraid to call us or afraid to go seek further treatment and health, and is ignoring those early signs of heart attacks or strokes. We just want the public to know that if you call, we're coming. I know that was like a concern that, like, oh, well, maybe we won't show up. You call, we're coming. We're taking multiple steps, as well as like the hospital, like you said, to help mitigate those risks and to protect the patients, all of them, not just COVID patients. So every day our ambulances are being heavily deconned in between every patient contact. You're seeing our crews go out in more PPE equipment than ever before. We're wearing gowns, masks, face shields.
And rightfully so.
That's not just to protect us. That's also to protect the patient as well.
Exactly.
We're giving a mask to every patient that we come in contact with. When you call 911, the first thing we do is we're giving you a surgical mask, and that's to protect us and you.
Yes.
And then we want people to call. We want people to get the treatment they need and not delay that, because when we go to the hospital, we are taking every precaution possible to protect those patients and protect ourselves, and so is the hospital. So I think that there is that misconception that I shouldn't call or I shouldn't go because of that, and we are taking a multitude of steps to help mitigate those risks.
Safe environment.
Yeah, that's exactly right. We're trying to create the safe for everyone.
To make them feel safe.
Yes.
And yes,
one of
Doctor.
the downsides to such availability of the internet and TV, the only pictures that end up on TV of emergency rooms are not calm, sedate, cordoned off images. Most people every night still see an image from the ICU in Italy with 50 people on ventilators. It isn't that way here. It isn't. I think in Massachusetts right now, I read a statistic that said 54% of the ICU beds in the state are filled. 54, it's not 94. Right. I still think the numbers will increase. I don't think this is going away quickly as people are hoping. Personal opinion.
Well, as we open up, that will be the
we
challenge.
can talk to that
right.
in a few minutes, because I think that's significant. I agree.
We'll do that after a minute.
But you know, the ER here is well set up. They've done a good job of cordoning off and sectioning off, and that's impressive. Plus the field hospital, not clear to me what's going on up there at the moment, but I watched the USS Comfort sail in and out of New York and treat like 15 patients, so I guess whatever.
A little overkill.
And, you know, it brings up
better
an
safe
important...
than not
well,
safe.
I was just going to say, it brings up an important point, because people are looking at the finances, the economics of this response, not necessarily the economics of the economy, but the economics of this. We don't have the luxury of time. We don't have the luxury of second guessing. So if you don't throw everything at it at the beginning, you're immediately behind the curve, the 8 ball.
And never
catch up.
Without a doubt,
yeah.
never.
So I commend them for not looking at that piece.
Yeah.
There'll be enough time later to quibble about who wasted money where. You know that's coming.
Yeah.
But that's the nature of the world. But right now, I think they did the right thing. They went at it full bore.
Yeah. I heard this morning they recently closed that hospital down the Cape. Because
right.
no one used it.
Never
but
treated,
you know what?
But that's great.
That's thank you. I'm happy they had to close.
Exactly.
They had to close it because no one used it.
It's a good outcome.
Thank you, God.
Exactly.
To be honest with you, but so Ryan, more towards your response and your response teams and what you do generally to protect. If we could just go over it again.
Sure.
When they get picked up in one of your and you pick up a person in your ambulance. What's going on, and how do you calm them down? We're going to go to the hospital, and believe me, I'll let you take it from there.
I'll walk you through a call, basically. Not getting into the medical side of it, but I'll walk you through a call.
Right.
So early on in the dispatch phase, the dispatchers are pre-screening these patients, asking questions, and that's just to give us a heads up. Doesn't mean we're not coming, just gives us the heads up. From there, we go into 2 different modes. If this patient meets a possible COVID criteria, we send in somebody in full PPE, which to us means a face shield or eye protection, an N95 mask, gown, doubled up gloves, and we send them in almost to scout it out, just to make sure that this is what we're talking about and to limit exposures to multiple people. From there, if it's deemed that it's not a COVID response call, we're still going in, we're still scouting it out. You're just not seeing us in the full gown. We're still wearing a mask and everything. Go in, first thing we're going to do is we're going to give that patient a surgical mask, regardless of whatever the call is for. We will then provide whatever medical treatments are needed for these patients. So you might see us show up, and there might be a small delay when you see us pull up and you see me dressing up one of the guys outside or one of the girls outside the ambulance, putting them into this kit is what we call it, the kit. That just takes a couple of seconds, and we've practiced this and done it so much now that it's almost second nature to get into it, honestly. They'll go in, they'll treat these patients just like we would treat them regardless before COVID-19 was here. They'll come out, we'll put them in the ambulance. Our ambulances are equipped with, we call them vents, moves the air that's inside the ambulance outside to almost create, to keep a clean environment. As I said before, the ambulances are disinfected in between every call at start of shifts and shift changes, so they're getting put into a clean environment. They're going to be treated appropriately in the back of the ambulance with their mask on. We ask them to wear a mask for themselves and us. And then right now, if a shift supervisor or myself shows up, we're giving the hospital a pre-call notification by phone, and if we're not, the ambulance is doing that. Give them as much time as we can on their end to get a room clean, prepped, and deconned ready for this patient. We'll transport these patients into the hospital, and the hospital's been phenomenal in trying to accommodate and make sure people are getting to the right areas that they need to. We'll even wait outside the hospital for a minute or 2 if we have to with the patient while the driver of the ambulance goes in and sees if the room's all set, just to limit people having to wait in areas that are possibly hot areas. And they'll go in, they receive the exact same care they would have. So our care level has not changed, even though that might be the perception. Our appearance has changed more than anything else.
Of course, yeah.
But we're still treating, we're still coming, and the mask for the patient is what we feel is a pretty big step for them to help protect them just from everything.
And I'm sure it's alarming to a senior.
We probably look very scary,
You walk in the house and there are two people in not just masks, but in gowns and
spacesuits.
We're wearing welding masks
yes,
almost.
And it has to be overwhelming. So, and I'm
Yeah.
sure you guys calm everyone down.
Yeah, we explain
Make
everything.
sure you're fine, and we just need to do this, and
And honestly, in this town, the public has been phenomenal.
that's great.
Not one person has come out yelling at us why we're waiting or taking so long. No one's complained of the way we look or anything like that. And I think everyone understands now. But yeah, we go in, we explain what we're going to do, and try and move forward.
We're very fortunate in this area that the population of this area is appreciative of the efforts, and even before this happened, largely they listen to the medical staff and they listen to people and they try to do the right thing. It's not as contentious as it has been in other locations from what I can see. Right. I don't think you can ever possibly say enough about what first responders have done in this situation. We always talk about putting your life on the line. This is a literal translation of that. So kudos to all of them. I frankly feel a little bit guilty sitting here because I'm not in the middle of it at all.
Yeah.
You know,
Well, we're doing our part right now.
well,
So,
for the next 15 minutes, I am, I
Yes,
guess. But
right.
yeah, I guess that's something. But clearly, kudos to them for
Yeah,
all the work and
yeah.
all the prep and planning. I would mention one thing that we didn't really touch on just for a second, if you don't mind, is the concept of virtual visits.
yeah, I was just going to mention that.
This is a
Telemedicine.
telemedicine. So this is a new field. It had started to come into its own a little bit in the last few years because of the technology platforms that are out there. But if people are reluctant, if people are nervous, it is an option. You can call your PCP or call your physician. I'm not sure what urgent cares are doing this yet, if any, so please don't take that as gospel. But I know in my own office where I worked, they are scheduling virtual visits routinely. And if you're concerned about your symptoms, you should be able to get in touch with somebody in a fairly short amount of time. Now, I can tell you, if you call somebody at my office, my old office, or urgent care, and you say, I've got chest pain, they're not going to tell you to see how it goes. Right. They're going to say, pick up the phone and call 911, which is fine. That's fine. But people shouldn't. My concern about virtual visits is most of us, including me, are technology challenged. I'm not good at it. So you say, oh my God, how am I going to possibly set that up and do it? There are ways to do it. There are people to help do it. And it's a very good alternative at the moment. And I think it will help to get people into the pipeline so they appropriately call for assistance when they should.
Yeah, it's important. And some will be reluctant to do that, or they just can't find anybody to help them.
Mm-hmm.
So we'll get into that a little later in the program here,
Sure.
Where they can call for that type of help, and in some cases on a daily basis. So you talked about the early warnings of cardiac arrest and stroke, and the early warnings signs of infection. So maybe we should go over what the residents need to know about the early warnings of infection and what to do.
So in terms of infection, it's basically this infection is no different than any other. So the warning signs are largely the same. Fever seems to be a fairly consistent but not universal piece of it. Chest pain, surprisingly, is fairly common. People complain of chest pain. Shortness of breath is clearly the major. But a lot of people will point to their chest and complain of either discomfort, trouble breathing, or both. And that's a pretty good sign. But I would say in any general sense, people experiencing trouble breathing need to be seen.
Right away.
So you can dispense with all the other stuff. If you can't breathe properly, you need to be seen. I cannot express how quickly something like that can go south on people if they're having trouble breathing. And we've all seen the results of that. So fever, chest pain, shortness of breath, rash is another big thing. And again, I'm not just talking about COVID. I'm talking about in general. You're asking about infection in general.
Sure.
So these are the signs. I don't know if you'd have anything to add to that or not.
No, I agree. That's basically the same that I'd be looking for as well if you called us.
I urge everyone not to go without prescribed medication. There are mail order prescriptions, drive-through pharmacies now that you don't have to get out of your vehicle. But I'm wondering if some of the doctors now for the elderly or for anybody that's on medication, maybe they can maybe a longer duration of a prescription, or a larger, I know they're driven by medical.
Well, they're driven by insurance.
Yeah. But I mean, in some cases, maybe you can speak with your doctor, and the doctor might be able to accommodate you with a little larger number of pills, say.
Yeah, I would think that would be difficult, only because of the insurance overrides. If you order another prescription before the first one is up, or if you extend it past the coverage that the insurance program provides, people will be left to cover that expense themselves. And I think it's easy to get a refill these days. You don't have to go anywhere to do that. You call or submit it
As a
online.
matter of fact, a few of the pharmacies are delivering.
Yes.
So
I think the pharmacies have been very good about
they've
trying
done
to
a
keep up in delivery.
great
and stuff.
job. They really have. They really stepped up, and I'm impressed.
I would just mention one thing. There have been articles here and there about certain types of medications perhaps making the COVID infection worse. And so people have been, there have been some stories of people holding their medications. Blood pressure medications was one that was particularly prominent. I can tell people that there is zero data, that suggests anybody should be holding any of their regular medications at this point.
They should take
people
them as
must
they need,
take their pills
as they prescribe.
as prescribed,
Right.
and they should be able to get refills from their physicians without exposing themselves heavily to
Phone call in most cases.
phone call or over
Yeah.
the internet.
Yeah, but they really they should not be afraid to go to an urgent care at all for a diagnostic appointment because of COVID and what happens if you don't go.
Interestingly, I agree, and interestingly, right now, it turns out to be one of the better times to go to an urgent care or to an office for a visit because there's no waiting. There's nobody there.
Yeah.
So I think it does work out relatively well.
And the consequences of not doing what we're talking about are dire,
Could
to
be
say
lethal.
to say the least.
Yeah, and I don't think it's a scare tactic to say people it could be lethal. It's clearly proven to be lethal.
Just be careful to take your medication.
Exactly.
As prescribed. Thank you. Mr. Snell?
I agree. People definitely should not be afraid to go to the urgent cares or go to your doctors if that's still being done with their physician or not. But as for the medication, we are going to fall into the same agreement here. We want people to take what they're supposed to take. I'm not a doctor. He is. If my doctor tells me to take something, I trust that my doctor wants me to take it for a reason. And
I just think that they're doing it for other reasons, not that they don't believe in their doctors. I think they're frightened that they're going to run out.
Yeah.
It's a different type of hoarding. But I think people should be reassured. There's no shortage of medications.
None at all.
Pills are
Right.
fine. Pharmacies are well stocked. I understand the reluctance about people wanting to go outside, but ordering by phone, some pharmacies deliver, as you say, others it's a drive-through, so you're really not exposed.
Take advantage of all the help they can get.
Yeah, it seems to be multiple avenues that it can be access to them.
Yep.
Okay, so I've got, I'd like to mention something that will help most of the seniors. We have Dartmouth Council on the Aging. I'll give the number out. They have a service where they call the residents. Get on the list if you want to. If you're all by yourself, or one of your relatives is going to watch this program, I encourage you to have your mother or your father or a friend or relative to call Dartmouth Council on the Aging, 508-999-4717. The COA will also work without older residents to answer any of their questions. So they have at this point, they're calling people every day just to check up how you're doing, check in, any issues, can we help in any way? And they're doing a heck of a job, and I commend them at the COA. And the whole staff is behind that.
There are several different organizations that will help. Council on Aging is excellent. They do a fabulous job with limited resources, I might add.
Yes.
There are other groups that, of course, have worked on this extensively, too. The hospitals had several postings, Facebook postings. There's a group called the New Bedford Wellness Initiative that's run by my colleague, Dr. Mike Rocha.
Right.
He's been all over this with data and posts and things. So you're right, there's a lot of help out there. People need to engage it, but it's there if you need it. And some of the forums are doing an excellent job of keeping up with the data about what to reassure people about, what they should be concerned about.
Yeah. So once again, don't be afraid to call the Dartmouth Council on Aging, 508-999-4717. Please take advantage of it. You'll look forward to that phone call every day. So I think I really feel that we've covered a good deal of the information. I didn't want it to get too in depth. It will become confusing to most, including myself. So I would just offer to give some closing remarks if you'd like, and I'll let Mr. Snell go first.
Sure. I just want to reiterate, you call, we're coming. So don't be afraid. We're still going to come. We're going to treat you, and we're going to take care of you to the best of our abilities and get you to the hospital as needed. So don't be afraid. You need anything, you call. We're coming to pick you up. We just might look a little different. We're still coming, and it's just to protect you, and you can feel at ease that we are taking every precaution necessary.
Thank you. Doctor?
I would just say that, to second your comments, which are perfectly appropriate, that people need to step back a little bit at this point and take a look at what it is that they should be concerned about. I think the initial fear and the initial spike in fear over this virus has kind of settled in. People are at least adjusting to a new normal. But part of the new normal is that we have to go back to some of the old things, and people should not put aside these symptoms. If you're concerned, if you're worried, you've got to make the call. There is no, I think the best way to put it is the increased risk of going to the hospital is far less than the increased risk of staying home with a heart attack or a stroke. So the exposure rates and the infection rates are what they are, and they will be what they're going to be, but it doesn't obviate the need for treatment in these really emergency, life-threatening situations.
Especially with a heart attack or a stroke, time is
exactly
the danger.
Well, time is the whole thing in medicine.
Yeah.
It's the whole issue.
Danger.
It's why he runs there at 90 miles an hour with his lights on. It's not because he wants to cut through traffic. It's because it's an emergency. And so I think, and again, I thank them all for their work and their service in this situation. It's really tough to watch what's going on.
I think we all appreciate what they've done, the nurses, the doctors, the first responders. They've stepped up to the challenge, I must say. And God bless them all, really.
It's definitely been a group effort.
Yes, yep. So thank you again.
Thank you.
So we'll conclude another program of Your Town. I'm Stanley Mickelson, your chairperson for the Select Board of Dartmouth. Thank you again, and be well, and be healthy, and take care of yourself. Thank you.